Cognitive processing therapy for PTSD. Cognitive processing therapy, also known as CPT, is a cognitive behavioral treatment focused on helping people who are stuck in their thoughts about trauma. It is one of the most effective treatments for post-traumatic stress disorder, PTSD. Introduction to CPT. Cognitive processing therapy is a specific type of cognitive behavioral therapy that has been effective in reducing symptoms of PTSD that have developed after experiencing a variety of traumatic events including child abuse, combat, rape, and natural disasters. This treatment is strongly recommended for the treatment of PTSD. Cognitive processing therapy. Cognitive processing therapy is an evidence-based manualized treatment that has been found effective for the treatment of post-traumatic stress disorder and other corollary symptoms following traumatic events. It focuses on how the traumatic event is construed and coped with by a person who is trying to regain a sense of mastery and control in his or her life. Research on cognitive processing therapy. Fortunately, research demonstrates that the efficacy of CPT is not compromised when it is delivered via telehealth. The findings from several uncontrolled trials, randomized clinical trials, and non-inferiority trials conducted in various trauma populations have shown that CPT significantly reduces PTSD symptoms when delivered through telehealth and is non-inferior to in-person therapy. How does cognitive processing therapy work? CPT, which takes place over 12 sessions and typically lasts 3 months, works by helping those in treatment address and change distressing thoughts experienced as a result of trauma. How can cognitive processing therapy help? CPT is designed to address the after effects of traumatic events. When first developed, it was used in the treatment with individuals who had survived violent crimes such as rape and assault. But it is now also used in treatment with people who have experienced traumatic grief or military trauma, among other issues. It is often used in individual therapy but can be adapted for group therapy and modified to fit the specific needs of a person seeking treatment. What to look for in a CPT therapist? Mental health providers can receive training and certification for CPT. Some institutions, such as university clinics, provide training seminars and workshops in CPT. Additionally, several CPT treatment manuals have been developed to assist clinicians in delivering the therapy. Training requests. Note that only appropriately trained clinicians with experience in cognitive behavioral therapy and therapy should attempt to use this treatment manual. Practitioners without this background are strongly advised to obtain training and supervision in general CBT approaches prior to implementing the approaches described in this manual.